when I first meet the patient, whether it's over the phone or in person, my job is to make sure that you have everything you need in order to be able to cope and understand what the treatment plan is. And so my job is to basically understand what the plan of care is from the doctors, make sure you understand the plan of care of the doctors, and then see if there's any kind of barriers to your care. So with breast cancer, a lot of times the first appointment is your surgical appointment. So I make sure that you understand where you're going to, when the appointment is. The doctor's office will do the scheduling of the procedures, whether it's the MRI of the breast or if it's CT scans or anything like that. I make sure that they come into a timely manner. So if there's a delay at the facility that you want to use, then I look and see if there's another area, or I look at talking to the right person at that hospital or that facility to expedite it, to explain that this is a new diagnosis for breast cancer. Can we get it in earlier? I work with genetic counselors. We have one here, Jennifer Probst, who is very good about getting patients in very quickly. So sometimes patients will call me to ask about that appointment, or they'll ask about, they want some more information about it. So I provide that for if I need to. We just basically are there from every point of care. So if the first point of care is surgery, then I'm there until they had their surgery, make sure they tolerate it fine, make sure that they know when their follow-up appointments. And then I help them with the care afterwards. So with breast cancer, sometimes it can be chemotherapy and then radiation, or maybe no chemotherapy at all and just radiation. So I make sure that the information goes from one specialist to the next, that your appointments are in a timely manner, that if we're waiting for some lab work to come in for some testing on the pathology, that the doctors have that information so that when you meet with them, they know what to ask, what to educate you on, and just to kind of determine what the treatment plan is so that they're ready at that time. So I'm here to make sure it's a smooth transition from one specialist to the next specialist.